Chapter 26 is going to deal with crisis and disaster. And what we'll find is that a crisis is usually when there is a struggle for someone to adapt or kind of reach that normal equilibrium after the situation has passed. What happens is your normal coping mechanisms are going to fail to deal with all the distress that you're feeling. So you're unable to function as usual in the aftermath. Usually two conditions are involved when you have this crisis. And of course, the primary cause of a crisis is, again, the actual traumatic event. There's two conditions that are going to be involved, and this is how the person perceives the event. And how distressing it is on them personally, and also they're unable to resolve this form of disruption that that usually they can take care of in a normal coping strategies, but now the ones that they've used in the past aren't helping them at this point. So an outcome of a crisis is usually going to depend on about three things. One is, what is the perception of the event? Is it realistic? Because everybody absorbs and works through processes in their own way. And then you have the situational support. And so this is ways that you use a crisis intervention, such as you're going to look at a quick, rapid resolution to an immediate crisis or an emergency by using people who are available to help you out at that time. And then you have your coping mechanisms. Of course, the more as we grow, we start to broaden our experiences, and we start to develop and adapt new ways to cope with new events. So we have new responses, new coping responses that we put into place. So this is a very interesting chapter. Try not to get it confused with stress, and it's more, again, the crisis and disaster and how we're going to deal with trauma and traumatic events. With a crisis, it results, again, in the inability to function as usual. We have an acute and a time limited. It usually lasts 4 to 6 weeks. Intervention therapy is usually short term, usually anywhere from 1 to 6 weeks on a present problem, and they only deal with that problem at that time. Your outcome is going to depend on what are your realistic perception of the event. So what's the patient's perception of the precipitating event? What was happening in their life before they started to feel the way that they're feeling? We also want them to describe how they're feeling right then at that moment. What are their adequate situational supports? Are they adequate or are they not? To whom do they usually talk to when they're feeling overwhelmed? We also want to ask, during difficult times in the past, who did you want to help you the most? A crisis intervention, again, is dealing with that crisis at that moment in time. And then we want to look at what are some adequate coping mechanisms, looking at their personal coping skills, what usually makes them feel better, and did you try it at this time? And if they did, what was different? Why did it not work? So those are some things that we want to look at when we're looking at these. They also have a figure, 26.1, looking at the effect of balancing factors in a stressful event. And that's on page 499 in your textbook. We have 3 types of crisis, and one is maturational. And this occurs as an individual is going to arrive at a new stage of development. So when old coping styles now may be ineffective during this time of their life or their maturation. So that's your maturational. Again, it shows that the individual arrives at a new stage of development and that their old coping styles may not be as effective as they once were. Situational crisis comes from an external source and involves usually a loss of some type of self-concept or self-esteem. Your adventitious, as it says, unplanned and accidental. This is a crisis of disaster that is not a part of your everyday life. And so again, natural disasters, national disasters. So when we think about the World Trade Center, Hurricane Katrina, the earthquake in Haiti, those are the types of things that would be more of the adventitious. In phase 1, this is the conflict or the problem, and what happens, it threatens the person's self-concept, increases their feelings of anxiety. The anxiety is going to stimulate problem-solving techniques and defense mechanisms to help them to solve problems and to reduce that anxiety. Here we have phase 2, and this is when defense mechanisms fail, and so that threat is still coming on, it's still persisting, and so we're going to do some trial and error to try to help solve this problem and to get us back into equilibrium. So the anxiety increases, the person begins to have feelings of extreme discomfort, and their functioning starts to become disorganized. In phase 3, that trial and error that you tried, it starts to fail, and so their anxiety levels are going to start to escalate to where it becomes that severe anxiety or at the panic level, and so they try to find some type of resolution. Sometimes automatic relief behaviors are mobilized, so someone may completely withdraw, or they may go into flight. What they'll do is devise some sort of resolution. So this is compromising needs or defining a situation that is more acceptable to them at that time. And then we have phase 4. This is the problem is still not solved. They're unable to find any type of coping mechanism, and now they're just overwhelmed with anxiety. This can actually lead to possible serious personality disorganization, depression, some confusion, maybe even become violent towards others, or start to have suicidal behaviors. And you have a YouTube video here. When applying the nursing process, when we start with the assessment, you have your general assessment. So general areas assessment would include everyone's perception of the precipitating event, the person's, so each family member's turn in time of need, who do they turn to, and how each one of the person in that family is dealing with the problem. Are they dealing with it together or separately? We always want to assess first for suicidal or any type of homicidal thoughts or plans. So safety is still always going to be your first consideration. Then we're going to start taking those initial steps to make the patient feel safe and less anxious. However, we cannot begin to expect them to do anything else for now. That just, feeling safe and less anxious is going to be our primary source, and then we're going to go from there. There's some assessment guidelines on page 501 in your textbook, and also page 504 for crisis. Let's see, box 26-2. I'm sorry, I wrote the wrong thing, but it's assessment guidelines on page 504. I'm not going to read these to you, but there's some great assessment guidelines there to help an individual. And then crisis intervention is box 26-2 on page 507. And it talks about the type of environment and how to set up for counseling and some activities to help the individual going through this crisis. There's a table, 25-2, in your textbook, and it's looking at some of the nursing diagnoses. One of those especially we use is ineffective coping, but it may also be some type of trauma, so they may have post-trauma syndrome, anxiety, acute confusion, sleep deprivation, risk for suicide, chronic low self-esteem, helplessness, hopelessness, social isolation. There's a whole list there on page 505 in your textbook. Then we look at the outcomes identifications and some of our goals. And on 25.3, table 25-3, they also talk about some of these outcomes identifications. But also, too, we want to think about their goals. The patient and the family will identify alternatives to their identified problems. The patient and or family will name and discuss at least 2 community organizations that can offer information and support. Another goal would be for them to identify effective coping patterns that will decrease their individual stress levels. And then we have report a decrease in stress. So those would be some really good goals that we would want to set up for our patient. As far as implementation and interventions, think about your basic levels, and again, your patient safety and reducing their anxiety. Assessing them for suicidal or homicidal thoughts or plans, listening carefully, and not only just listening, but watching their nonverbal communication, doing crisis intervention, and making sure that they have everything set up of what they would need if they do need help, who they can call, where they can go, what are their social supports, and helping them to identify those, identifying their coping needs, looking at realistic and acceptable interventions, and then, always follow up, check in on them, some type of progress report. For crisis intervention, we have primary, secondary, and tertiary care. The immediate crisis intervention is going to deal with the present problem and a resolution of the immediate crisis, so the here and now. Your primary care crisis intervention promotes mental health and is going to reduce mental health illness. So your secondary is actually taking care of everything, and then tertiary is your follow-up. You can look on some good examples are on page 506, talking about counseling, and it goes into your primary, secondary, and tertiary care. There's also 7 phases to critical incident and stress debriefing. They have excellent little part there in your book, so I won't read through those to you. You can read those yourself, but it talks about the phases. And it's on page 507, and it starts with the introductory phase, fact phase, moving all the way through till you get to the reentry phase. So it has an excellent section there for you to review. One of the things that does help is known as your disaster management continuum. And this is where we get prepared. And so you probably, if you already work in a facility, and like how we did the tornado drills here the other week, prepared. So it's being prepared. Mitigation is working with all the sources that are going to be involved in some type of disaster, making sure everything's in place, making sure that we have communication to respond back and forth, and how everyone's doing. Is everything working? Is everything in place? And then the recovery afterwards. And then at the end, we're going to evaluate. How did we do? What didn't work? What did work? What do we need to change? And evaluating the whole process. This is something else that we want to look at when we look at events that happen. And we don't wait for the event to happen and then not be prepared at all. So again, you want to have your plan, which is your preparedness. You want to your mitigation is to limit the impact on people's health, your community. Then you're going to have the response, which is actually implementing the plan. And then your recovery is, again, stabilizing everything back to normal, the community, the public, and trying to get everything back to your previous state. And again, evaluation, and evaluate the response effort, and how prepared were we, and what do we need to change.